So thank you all very much for joining the call, the webinar, and thank you, Margaret, for participating and being willing to share your presentation and study with us today. Margaret is working for the City University of London, and she performed a study on the monitoring of problem gambling in several jurisdictions in Europe. The study was published actually in April of this year, and we, the EGBA, has commissioned the study. You might probably know EGBA already, but we're a Brussels-based trade association of leading European online gambling operators. And as such, we represent the industry and participate to policy discussions, both here in Brussels at EU level, but also at national level. And one of our priorities is safer gambling. That's obviously a very important topic, and even more so now than before. We have commissioned the study because it is a priority, but there's also a lack of data and research in our sector, and we are committed to help to do our bit to improve the research and the data and the better understanding of problem gambling. It's part of our overall commitment of our members towards safer gambling and to promote a safer culture. In this respect, we will also publish shortly, hopefully by the end of this month or early June at the latest, our second sustainability report, which highlights the work that our members are doing in terms of improving safer gambling and the tools that they use and increasing knowledge that they gain from using tools and how to further improve them. That study will be published, or the report, sustainability report, will be published in, as I said, in a month's time at the latest, and it will contain some very interesting new data, and we invite you to take a close look at it. We've done a study on consumer protection tools before with Margaret, that was published earlier. There was actually an update on an earlier study, and so that's part of our overall commitment. We will also soon announce the date of the second European Safer Gambling Week that we organized last year for the first time. It's a week where we, together with other associations across Europe actually, organize several events around safer gambling. As I said, the date will be announced, but we are aiming for October, but we'll get back to that as soon as possible. Okay, now going back to today's presentation and the webinar, the logistics. Margaret will do a presentation of around 40 minutes. You'll be able to ask questions, and we'll do a Q&A at the end of the presentation. As per usual, we will have you will have the opportunity to write your questions in the dashboard in the question section, and then we try to answer, or Margaret will try to answer the questions at the end of our presentation as good as she can in terms of the timing. If they can't answer all the questions, we will do that in written afterwards. Please note that the webinar will be recorded and will be circulated to attendees tomorrow, and will be made available on our social media as well. And we'll also share the slides from Margaret with you afterwards. So thank you again for Margaret for being willing to do this presentation. We had a look at the study, of course, and we're very pleased with the outcome, or we're pleased that there is a good outcome. Maybe not so much with the overall outcome of the picture that it paints, but we're very pleased that the study has been done. And we also like to thank all the gambling regulators across Europe that contributed to this study. Without you, it would not have been possible to come up with the information. So thank you very much for those that are also dialing in today for your willingness to help and make this study possible. So without further ado, I'll give the floor to Margaret. Don't forget that you can write your questions in the question box to the side. And Margaret, the floor is yours.
Okay, thank you, Martin. Thank you, Martin, for inviting me here and for being able to present the finding during this webinar. Can I just check that everyone is able to see my screen? Martin, can you confirm that you can see the screen?
Yep.
Brilliant. So thank you very much for the introduction, and good morning, everyone. And thank you, everyone, for joining me today for this webinar. This is where I'm going to discuss my second recent study, as already explained by Martin, that was carried out for the European Gaming and Betting Association. I understand from some of the emails I got before that some of you have woken up very, very early to join in this webinar. So I would like to say that I admire your dedication, but more importantly, I hope you will find the session interesting. Now, the study that I'm going to look at today aimed to identify how European member state and some other European jurisdictions measure gambling engagement and problem gambling levels within their countries, and to have a look as to what similarities and differences exist between the different jurisdictions. Now, the main purpose of the study was a fact-finding exercise, and that was to identify which jurisdiction assess gambling engagement and problem gambling levels via systematic nationally sponsored survey, and which adopt different methods to assess those aspects. Now, the importance of that is that we felt that it would be a very useful project, as there are some systematic studies that are carried out by academics, and those try to identify what surveys have been carried out within any given state. And they will tend to report on the number of surveys, they will report on the engagement levels, they will also report on the problem gambling levels. But they tend to focus on publications in academic journals, so they are not necessarily accessible to everyone. But more importantly, they do not aim to identify individual jurisdictional approaches, whereas this is what my study aimed to look at. And we were trying primarily to add to the existing body of research, to add the new element, and to provide data of the approaches that jurisdictions take, and in a manner that is accessible to everyone, regardless of whether they have access to academic journals or databases or not. Now, the study aimed to see whether any jurisdictions also have adopted any definitions of gambling-related harms, and whether any of those have been put on statutory basis. And the reasons why I wanted to identify it and wanted to have a look at it is because it's quite important to see what countries include within the scope of benefits of gambling, but also what they include within the scope of any potential harm of gambling. Because without having a specific scope as to what is included in either of those, it's very difficult to make a meaningful analysis of the cost versus benefit issues. So we ask as well the questions as to whether there are any specific definitions and whether they vary from the traditional definitions provided by World Health Organizations or the American Psychiatric Diagnostic Manual. So what we also did is to collect the data of the most recent gambling engagement levels and problem gambling levels within the jurisdictions. But I would like to emphasize from start that they were collected for information purposes only, and to see if any of the countries can identify any specific trends. But in no way they were intended to try to be used in order to compare the different levels between different countries. In any case, as we will see through this presentation, there are so many differences in how the data is collected and what screening tools are being used, what intervals are adopted, that it is not really possible to make any meaningful comparisons between the countries without quite a substantial overhaul of the data itself. But it's important to emphasize that the study was never intended to be used like that, and it was not intended for comparison purposes. So I would like to say that it really shouldn't be tried to be used in that manner. I would also like to add, importantly, that there was no intention whatsoever in the study to name or shame any country as well. This isn't to try to identify who is doing very well or who is not doing very well. That was not part of the study whatsoever. But it was simply intended to find out more about what the current situation really is, and also to start conversation as to whether the status quo is optimum or whether something else could potentially be done to change that, to improve it, or potentially to come to the consensus that what it is as good as it gets. So that brings me to the issue of methodology. And when we look at methodology, it was really very similar to the one that I adopted for the regulatory study that focus on regulations within the European member states. And those of you who may have attended my previous webinar, you will know that the surveys that were sent out to relevant regulatory body, government officials, or another responsible stakeholders were sent both at the same time. Now, the data for this particular part of the study was collected between March 2021 and February 2022. And the reasons why it has been quite an extended period for the data collection is that it proved quite difficult to obtain the data. And partially, this was probably due to COVID, as it was still happening where countries were emerging from the pandemic. Quite often, the data that relates to the gambling engagement collection method and problem gambling prevalence levels would be held by bodies that are also responsible for health-related matters. So quite understandably, they were rather preoccupied with the pandemic. But even though during the collection of the data, some of the things may have changed, so some additional surveys may have been carried out, it's unlikely that the approach itself would have changed dramatically in the short period of time. But also, what is important to stress is that even though we were hoping to get the data for all European member states, that unfortunately hasn't proved possible. And probably primarily due to COVID, we were only able to collect the data that was sufficient for the inclusion purposes from 20 countries. And those 20 countries include 19 European member states and the United Kingdom, which at the moment is no longer part of the European Union. The data was collected by responses to a short questionnaire. What the questionnaire asked the respondent to focus on, what essentially is what method the specific state uses to assess levels of gambling engagement, what method they use to assess levels of problem gambling, whether they carry systematic national surveys, whether they adopt any official definition of problem gambling and gambling-related harm, and what were the gambling engagement levels and problem gambling levels between 2016 and 2020. Excuse me, please. Apologies. So respondents were also asked to comment whether the data allowed them to identify any specific trends in behavior or levels of engagement of gambling disorders over the last 5 years, and whether they have any statutory definitions or any specific definitions that they adopt within their countries of gambling-related harm. Now, of the 20 responses, 19 have been provided by the relevant regulatory bodies of those jurisdictions or a responsible person within the governmental department. And one response from one country was provided by the National Gambling Association rather than the regulator. Now, in addition to the responses provided by the relevant stakeholders, I have also looked at the systematic studies which were carried out in order to identify what surveys have been carried out prior to the durations of these surveys, and to see what methodologies were adopted. And I'm going to briefly present the finding of those systematic studies as well. All these responses were collected and analyzed to determine similarities and differences. And of course, even though I have quite a long period of time for today, it's still a limited time. So I will only focus on the high-level findings. And of course, the full-level findings are presented in the report. And the report is already available and published on both the EGBA website and also on City University of London's website. Finally, very briefly, in terms of the acknowledgement, as with any studies that rely on getting the data from relevant bodies and relevant responsible people, I would like to thank everyone who contributed to this project and who took the time to actually respond to it. I know that everyone is incredibly busy and it's very difficult to find the time to do so. I'm sure quite a lot of you will be getting quite a lot of requests for the information. So I'm really grateful for all the responses that I have received. And I would like to directly specify that, of course, without the responses that I get, this project and this webinar would not have been possible. So thank you very much. Also, thank you for EGBA to help with the data collection exercise and to provide the contact details of who the survey should be sent to. But in terms of the limitation and disclosure, for disclosure purposes, as it is quite obvious by now, I hope, but I still have to state it expressly, this project has been fully funded and supported by EGBA, but there is no other conflict of interest. The main limitations of the project is the timing of the data collections, because it took longer than originally anticipated. Some of the data may have changed, especially with regards to the engagement, because the engagement problem gambling levels in the report stops at 2020, and of course we are in 2022. Some of the surveys were carried out in 2021, and the data are slowly being reported. And also all the details have been provided by the respondents without any standardization exercise being carried out, and they are presented as provided by the responses rather than any independent analysis of that. So what are the findings of these projects? Well, to start with, it is perhaps important that it is very clear that all countries aim to measure gambling engagement and problem gambling levels. And all countries take the matter and the corresponding consumer protection and social responsibility measures very seriously. So regardless of the actual approach that is being taken by the jurisdictions, it is quite clear that this is an important area, and this is something where quite a lot of initiative have over the last 10 years been taking place, and quite a lot of countries have introduced a lot of measures where they can identify what the engagement is and what the potential problems that may arise from it. As mentioned already before, we can already see that element from the systematic studies that also identified what surveys were carried out. And I just want to bring to your attention two of the studies because they are the most relatively recent ones. The first one is the one that was carried out by Williams, Wahlberg, and Stevens. And they identified 19 prevalence studies that were carried out between 1998 and 2015 within the relevant European countries that are included in the scope of the project, plus 3 more surveys that were carried out in the UK. The study by Williams et al. Have actually looked at the surveys that were carried out in the whole world. So it looks at the America, Canada, Far East, Africa, and other jurisdictions. But what I have done in the table that is currently presented to you is extracted the studies that were identified for the countries that were part of the European data collection. Now, what was also important about the Williams study was that they carried out the standardization exercise. And what this exercise does is to essentially convert the absolute problem gambling levels data that it's presented by the surveys and convert it into something that can be comparable between different jurisdictions to try to make them into the levels that would have occurred if the same screening tools was used for the surveys. So this essentially enabled comparisons to be made between different countries. But it is important to mention that such standardization exercises are very time consuming and expensive and cannot realistically be carried out in a regular manner. Also, there is an element that while we know or think that we know as to how different screening tools provide different outcomes and how they can be converted and standardized, there is of course a significantly more scope for errors in those exercises than it would be the case if the same methodology was used from start. Now, the second study to bring to your attention, it's also a relatively recent one, which was carried out by Calado and Griffiths. And they focus on the period between 2000 and 2015. So there is an overlap between those two studies. But the previous study looked also at the previous years, whereas Calado and Griffiths looked at the one from 2000 to 2015 only. Here, they did not carry out standardization exercise, so they essentially reported how many studies were carried out and whether they measured a past year gambling engagement or whether they measured lifetime gambling engagement. Some of them only reported the gambling problem levels as opposed to the gambling engagement itself. So what this study has identified, it identified 31 number of studies, 31 number of surveys from within the European member states, and 5 further studies that took place in Great Britain during the period in question. Of those, 19 studies measured past year gambling engagement, 6 lifetime gambling engagement, 11 did not measure gambling engagement, but only reported on problem gambling levels. And some of them included the details of the methodology and the screening tools, and some didn't. So as we can already see here, there are many national surveys that are being carried out, but the methodology, intervals, and the target groups continue and has always differed between different states. So that brings us to move to the existing study that I have done for EGBA. And it's interesting to note that from the 20 responses, I've managed to get the 20 states, 12 countries specified that they carry out regular, systematic, and nationally sponsored surveys at regular, pre-established intervals. Now, this doesn't mean that other countries do not carry surveys. In fact, some of the other countries carry more surveys than the ones who are doing it in a systematic manner. But it simply means that other jurisdictional approaches do not necessarily require those surveys to be carried out in a prescribed, regular, or nationally mandated manner. But as already mentioned, some of those actually carry out more surveys than the others. So in terms of the 12 countries with systematic national surveys, it's interesting to note that one country, Cyprus, actually has the obligation to carry out the surveys that are mandated within the statutory instrument. So it is included in the actual legal requirement. And it's perhaps surprising that it's only one country that does that, but of course, in other countries, even though there may not be a legally mandated requirement within the statute, the regulatory bodies quite often facilitate those as well. And that's why it is important to mention, because I think that sometimes we forget that regulators have to work within the law that has been prescribed by the legislators. And it's the legislators who really need to decide as to what must or doesn't have to happen, what the priorities are. And while regulators often have a large scope of what they can or cannot do, their priorities are dictated to them, and it's not something that they can deviate very easily by themselves. So it's quite interesting to see that despite the legislator not prescribing the mandatory national surveys in the vast majority of the countries that are within the scope of the study, it's interesting to note that regulators still look at it as the preferred method of assessing gambling engagements and problem gambling at national levels. But this is pretty much where the similarities end. And this is because almost everything becomes different. So when we look at the intervals as to how often or how not often the surveys are carried out. And the intervals can be as short as quarterly. So for example, in UK, the Gambling Commission carries out quarterly telephone interviews with national representative samples using an abbreviated PGSI screening tools. Czech Republic is having two of the surveys that are carried out annually. But then the largest intervals is 5 years. And there are intervals that are in between the quarterly and 5-year period. So in some countries, the surveys are being carried out every 2nd year. In others, every 3 years, and every 4 years, and the maximum one of 5 years that has been identified. But it's also important to note that those intervals are actually still in flux, and they are relatively recent and subject to alteration. So to give you some example, in Denmark, there were 2 previous surveys that were carried out in 2005 and in 2016. But from the current year, the Danish Gambling Authority decided to introduce regular prevalence surveys that will take place every 5 years. Greece carried out its first quantitative study about the features in players' and non-players' behavior only as recently as in 2020. In Spain, the national data surveys on drug addiction has been carried out for a long time. But questions on gambling were added only in 2019. So again, still relatively recently. Previously, Spain's gambling engagement was measured in 2015 and 2017 via specific studies that were commissioned for the purpose of assessing the regulation of gambling, but now it is being added in a systematic manner. Czech Republic carries out 3 separate surveys, and 2 of those are taking place annually since 2012, and those are part of the omnibus studies, and 1 is carried out every 4 years as part of their large-scale household survey on substance and addictive behavior since 2008, but the questions on gambling have been introduced to this survey also in 2012. Again, other changes can also be identified in other countries. So, for example, in Sweden, the National Public Health Survey was carried out annually until 2016. And this is when the interval was changed to every 2nd year. But in Sweden, you also have a 2nd survey that is carried out on special assignment from the government when it's needed. In the UK, bespoke gambling prevalence surveys were carried out up to the year 2010, but they were discontinued and replaced with gambling-related questions being included in the health surveys. And in addition to those health surveys, the Gambling Commission carries out the telephone interviews that I've already mentioned. It looks like only Finland appears to have a reporting system that has been stable for a long period of time and one that continues in its original form up to the current date. So the intervals itself is already different, but also the vehicles, the mechanism through which the surveys are being carried out are also different. So 7 jurisdictions use gambling prevalence surveys or population-based surveys. 3 jurisdictions use health surveys. 2 use health and lifestyle surveys. Others use bespoke measures as well. And the reasons why the vehicle through which the surveys are carried out are important is because it is known and it has been proved that it's not only the screening tool that produces different levels of problem gambling, but also different vehicles will produce different outcomes. So it has been shown that, for example, health surveys are likely to produce lower levels of problem gambling in comparisons to bespoke specific gambling prevalence surveys. But the actual differences are very difficult to quantify as to the extent and scope to which the mechanism affects the outcome, as opposed to what should be the main measure, it's the screening tool itself. So again, here we have different methods of doing the surveys. What we also have different is who is considered to be an adult in the context of those surveys. Now, the reasons why this distinction is important, because there are separate surveys being carried out with children, those who are normally not permitted to engage with gambling in any jurisdiction. And adult surveys are treated as separate and by being carried out separately. So who is considered as an adult, as a person to be included in the survey, also varies. And the age ranges are from 15 to 74 years old, 15 to 64, 18 to 75, 16 plus with no age limit, 18 plus with no age limit. So there are some states which don't have upper limit, some which do, and the upper limit also varies from place to place. So when we have the national surveys, we know that they are being carried out, but the intervals, who are being surveyed, and the method will differ from state to state. The other countries that did not report a systematic nationally sponsored surveys still carry out a measurement method and still do assess the levels of gambling engagement and problem gambling. They just do it in a different way. And this is important because, for example, in Belgium, one of the countries that has been classified in this group, prevalence studies seem to take place more frequently than some of the countries that have reported systematic use of the surveys. And the more recent ones included the public health surveys from 2018 that was carried out by the Federal Research Center that is linked to the Belgian Ministry of Health. Also, the Belgian Higher Health Council also supported another study in 2018 carried out by the Flemish Expertise Center that assessed gambling rate participations in Flemish people age 15 and over and the risk of dependencies. So another example that I can give you is Italy, where the Ministry of Health that is responsible for government policies relating to problem gambling also carried out epidemiological project between 2016 and 2019, and surveys were also carried out in Ireland and Latvia and other jurisdictions. So those places, they still do have surveys, but they may be ad hoc national surveys. They may be other types of surveys and are not necessarily mandated or regulator sponsored. In 3 countries, gambling engagement and problem gambling levels were reported to be estimated by reference to the number of registered players and the number of people who are on the self-exclusion registers. So this brings us to the actual screening tools. And again, I already mentioned that the vehicle will impact on the outcome and the levels of problem gambling. But the most important differentiations would be the type of screening tools that it's used. And there are plenty of them. There are plenty that have been developed. Some have been developed for the purpose of being used in national population-based surveys. Some of the screening tools have been developed for the purpose of using in medical settings to screen those who are presenting themselves with potentially problem gambling symptoms, and others that have been created to create abbreviated versions of the primary tools to make them more convenient to use in large-scale population surveys. So they will also have slightly different cutoff points as to who is defined as falling within the category of having a problem with the gambling, who is defined as being at low risk or at medium risk. And again, with using the different tools, it's very difficult to compare the actual outcomes. They can be compared if standardization exercise being carried out, because it has now been established as to how the tools compare in terms of the actual outcomes. But even then, this is quite a difficult exercise to carry it out. So what are the tools that are being commonly carried out? They are jurisdictions, 4 jurisdictions that carry out 2 measures in the same surveys. There are jurisdictions, 9 of them which use PGSI. There are other jurisdictions which use NOTS, other SOCs, DSM-4, DSM-5, and there are also others who use their own bespoke screening tools that they devise for the purpose of surveying their customers. In terms of the definition of official gambling-related harms, it's interesting to note that no country has an official definitive and exhaustive list of gambling-related harms. Finland has health, social, and financial harm listed in the statute, but of course, health, social, and financial harms are quite broad terms. But health and other professionals and regulators consistently report the awareness of the range of problems that gambling can cause. And there is absolutely no dispute that I'm pretty certain that everybody is aware of what the gambling externalities can be. But the actual scope of what is included in any calculations of what the cost of gambling is, it really depends on what types of harm and the treatment of those harms or prevention of those harms are actually included. And I personally think that without a clear definition as to goes within the scope of what should be classified as benefit of gambling and what should be classified as the potential harm of gambling, it's very difficult to have a robust measure in terms of identifying the benefit versus risk, the benefit versus cost. Because if we don't know what we are including it, or we're including very broad categories, that there is a potential high level of errors that we could actually lean towards less evidence and more as to what the public opinion actually is in the matter. So that's why I would say that while I'm 100% sure that everyone is very aware of what the potential harms are, it would be really beneficial to have a more commonly agreed list of what we really count as the real harms and what perhaps shouldn't be counted in this context. Now, I have also added the tables that were provided, and the table of the gambling engagement rates from 2015 to 2020, and also the problem gambling levels. But as I've already mentioned, those are absolute raw numbers. So they are the numbers that have been provided by the respondents, and those are the numbers that have been produced, including different types of gambling activities and with problem gambling, different screening tools. So they're really here for information purposes and to see whether any trends can be identified within any given jurisdiction, but they cannot meaningfully be used in order to compare one jurisdictions from the others. Now, this brings me kind of to the end of what I wanted to present in terms of the high level. I would like to ask you some questions as to what you think in this context is important. I think one thing that sometimes we don't answer expressly to ourselves is, why are we monitoring problem gambling? How does it impact the development of gambling policy? What is the interrelationship between the surveys, the monitoring, and what we are actually doing on the legislative and regulatory landscape? I also would like you to ponder as to what do you think, why do you think there is so much divergence between how gambling engagements and problem gambling is being measured? Those divergences may not appear significant because mainly we have the surveys, but if we look at the details, they do produce different outcomes. They test people at different times. So they don't allow for any necessarily meaningful data to be taken at international levels. They are meaningful for the given jurisdictions, but not necessarily outside it. And also, I'm wondering, what do you think needs to happen for the countries to convert the gambling engagement measurement methods? So to conclude, I would like to say that personally, and this is my personal opinion, nothing to do with EGBA, is that I think it's quite difficult to find a robust justification for the present situation. What is commonly advanced as the justifications are cultural differences, historical differences, jurisdictional priorities. But in my mind, the question is, are we really that different? I know we are different, and of course we have different cultures, we have different approaches. I'm not disputing that in the slightest, but are we really that different in the context of problem gambling or gambling difficulties or gambling engagements that would justify the differences? After all, there is a pan-European study, there is a pan-European survey that assess levels of various activities, including participation in gambling and gaming and social media and alcohol and others, that it's carried out among children across all European states. But no similar survey is carried out for adults. And I personally think that a similar survey would be very beneficial if carried out with adult population as well. But I also recognize that such surveys are very difficult to organize. They're also very expensive. So I hope that at least this report and these presentations will start the conversations as to whether the present status quo is the right one, or whether there is any appetite in order to review it or potentially change it. So that brings me to my time, and I hope you find the brief talk interesting. Thank you very much for listening, and happy to start the conversation now.
Thank you very much, Margaret. Thank you very much for a very interesting presentation. We're already having comments and questions. And please, if you have any questions or comments, use the questions in the in a little box on the left or right hand side. So please go ahead and fire your questions away. We'll try to ask Margaret as many of the questions as we can. Just before we start, I also have one question, and I say also relation to maybe the question that you asked us in your last slide, and I mean, that's actually about so maybe we should have asked you to investigate as well as part of the study, but what is there a common objective why monitoring of problem gambling is taking place? Is it as far as you can tell to influence policymakers, or is it just to inform policy making, or is it to inform the general public, or is there a shared objective as far as you know in why these studies and surveys are being carried out?
Okay, thank you for this question. Of course, I can't say for certain what the position is because that wasn't part of what I looked at the study. But from my perspective, I think that in the vast majority of jurisdictions, the survey are carried out for dual purposes. So they are carried out primarily to inform, primarily to monitor if there are any potentially worrying trends within the problem gambling levels. Also to monitor if there are any beneficial trends that can be identified. And the information element should not be underestimated because it is important and it does provide quite a lot of data that could in many respects be very useful. The second purpose, I think, is also to underpin some of the legislative policy making decision. So some of the data can show that, for example, some people may argue that if you liberalize gambling, that it produces lots of problems. And when that happens, we always have the novelty approach where levels of problem gambling may rise, but then it tails off because you have the adaptation process that kind of tempers it. And in many ways, it can go a long way to show that some of the statements that were made by the public opinions were not necessarily correct. But there is a limit to what this can actually be used for. Because at the end of the day, the surveys only produce statistical analysis of what is happening and how many people are engaging in gambling in a specific period of time, and how many of those people have reported that they may either suffer from problem gambling issues or they may be at risk of developing such problems. But they don't necessarily explain why. They don't necessarily explain all the variables that may contribute to the position. Which is why from the policy-making decision, those are useful data, but they have to be looked in conjunctions with everything else, because as a stand-alone, they are not as insightful as perhaps we would like them to be.
Okay, thank you. So we have, as I said, a few questions or several questions coming in. One of the questions is, most of these studies are based on telephone inquiries. What's your view about gambling account-based data to monitor problem gambling? So I guess that's data from actual players to be used, if I interpret the question right, to monitor actual problem gambling data. Could you comment on that, Margaret?
Absolutely, and I'm sorry if I'm going to sound very controversial here, but I personally think that we should be assessing gambling engagement and problem gambling levels through the players' data as opposed to the surveys. And I will explain to you as to why I think that. And that's because we are human beings, and human beings have a tendency to remember what we wish to remember, and not necessarily admit to things that we do not necessarily wish to admit. The recollection bias is very strong, whether we like it or not. As much as we can say that we are being very truthful and honest in the surveys, sometimes we may genuinely forget that we may have had some issues in the past, or we may not wish to admit. There have been quite a lot of studies carried out that shows that telephone interviews and the self-reported data has to be treated with an element of caution, because people, quite a lot of them say exactly as it is, but the recollection bias, the unwillingness to sometimes admit that they may have a problem may distort the data, or some people may be opposite. They may actually exaggerate the problems that they have, where in fact, if they went for a screening at medical settings, they would not be identified as having an issue. So in this context, I would personally say that looking at the player's data and the actual, as long as it could be comprehensive and viewed from a holistic point of view and not from individual operators only, would probably be significantly reliable in this context. And I appreciate that this is not something that perhaps lots of people would want to hear, but that's what I personally think about the matter.
Well, actually, quite a few questions that we received are actually about this, and also whether, for instance, a single customer view, so that's sort of a shared database of what every player is doing on different websites, whether that could be a good base as well. So I think there's a lot of questions going around to this as well. There's one remark that I want to share with you, or the viewers, which I think misinterpreted the objective of the study. So the question is, if the measures represented or presented in the study are only informative due to the lack of common methodology, what is the value of the present study? But I think, I mean, from our point of view, the study is not so much about what are the rates, but it's more about how are things measured. But maybe you want to comment on that as well, Margaret?
Well, what you just said, the value of the study is that presents the approaches of individual jurisdictions. And while you cannot compare between different jurisdictions, the data is relevant for any given jurisdiction. And as you look at the regulations within specific jurisdictions, they differ. They will be meaningful for the particular countries. And in terms of the approaches and the tools to highlight the differences and to highlight the lack of common methodology, this is itself is quite valuable in terms of bringing it clearly to the attention of everyone. Because quite often people, when they look at the broad picture, they may say, oh, everyone is doing the same thing because everyone is doing surveys, everyone is assessing gambling engagement, everyone is assessing problem gambling levels. And if you don't go beyond that, it could easily be perceived that that's pretty similar everywhere. And it is similar with regulatory parts, that if you look at the high level regulations, they are very similar. But yet when you look at the details where it really matters, then you can identify how different they all are. And at the end of the day, if anyone wishes to do the comparison, a standardization methodology is out there in order to do so. That wasn't part of the scope. At the end of the day, lots of studies are being carried out, and some people find it useful, some people find it less useful. It's entirely within what is a particular interest of any given individual or organization. I hope that addresses the question.
Absolutely. We have a bit more time and we have many more questions. So there are a few questions as well that is about, I'll read this one out. So how frequent do you think countries should complete these surveys? But I guess that's and other questions around it as well. I guess that's around best practices. So is it possible to identify best practices in terms of survey, and if so, what are they? I mean, we have you don't need to enumerate everything because we have very short time. But is there best practices?
Very quickly, it's not for me to assess what is best practice. I would say that, some people would say that in the UK it's being done quarterly, that it's a very thorough. Some people may legitimately argue that that's perhaps too often and doesn't necessarily justify the cost of carrying out. I would say that every 1 year, every 2 years, it's probably a very good intervals. Anything less than that, maybe a bit too often, but anything more than that, maybe a bit too short. So it really depends again on what is the purpose of the surveys, what we are trying to achieve, and how quickly we're trying to react if some potential trends potentially are identified that are worrying. If you carry out survey on an annual basis, then within the space of 5 years, you can see if there is a trajectory that it's going in the wrong direction and something has to take place to introduce preventative measures. If you have surveys every 5 years, then it will take you 15 years in order to get to a similar conclusion. So I would say that annual surveys are probably very good. Less than annual surveys are also very good. It's just that some people may say it's too expensive for the benefit of getting the data even more often. Every 2 years is probably also sufficiently often enough in order to get the data you need in a reasonable manner. Every 5 years is perhaps too long. But that's my personal view, and you know, I wouldn't know what is considered a best practice per se.
Okay, thank you very much. One more question we have time for, I think. So, I mean, it's also a question that I think is a relevant question as well. That I personally have as well. I mean, how does this relate? These surveys relate then to questions about the effectiveness of certain consumer protection measures and how you can measure effectiveness. I guess the question is around having a survey that shows trends and let's say the bigger picture. And you can also, of course, have more detailed studies or measurement of effectiveness of an individual instrument that either an operator applies or that are legally required. Can you comment on that? Is there anything to say how they relate to each other?
I would say that any relations between the outcomes of the surveys and specific social responsibility measures have to be treated with caution. And holistically, they provide good data whether overall the regulatory landscape is doing a good job in protecting consumers and preventing gambling-related harm. But because the data is very broad and it's very overall, then it has to be looked at it from an overall perspective as to the whole regulatory landscape. If we really want to decide whether any specific social responsibility measure is robust and effective, we would need to assess the effectiveness of the given measure, whatever it is, whether it is no payment by credit card, or whether it is a holistic view, or whether it is a specific period of self-exclusions or timeout. They would have to be assessed on an individual basis, because otherwise there are so many different variables and impacts on things that we could only look at the overall outcomes in a holistic manner. And that is quite difficult. The methodology of assessing effectiveness of any specific measure is very hard. But if we accept that, then we have to also accept that the prevalence studies and the problem relative rates are giving us an indication, which is important and good, but it doesn't give us a definitive outcome, definitive answer.
Okay, well, thank you very much, Margaret. We have more questions, but not enough time, which is always a good sign. Thank you all for participating. Thank you also for your sending in your questions. Thank you, Margaret, for a very interesting and clearly thought-provoking presentation and study. I think we'll get back to this topic obviously at the later stage again, because it really, there's a lot of questions still unanswered. So we'll get back to this at the later stage. Thank you all for joining us. Thank you, Margaret, again for presentation. As I said, tomorrow we will send you an email with the video and slides. And in the meantime, yeah, thank you very much, and we hope to see you soon again.
And thank you for inviting me to do this webinar, and thank you for listening, and I hope you find it enjoyable.
Thank you very much, Margaret.
Thank you.
Bye-bye.